HIV leadership, and thank you, and ensuring that the benefits of U equals U reach all people living with HIV everywhere. Today, we will not only highlight the scientific advancements, but also examine the barriers that prevents us from universal access to ART and viral suppression. We will learn from our panelists from Brazil, Ghana, and Canada, the power of HIV leadership in the movement to expand ART access, as well as promote the integration of U equals U into the national HIV strategies. But before we start, I am inviting everyone to use the chat box to network with each other. If you have any questions, you may use the chat box. Sorry, I'm just gonna put my cat down. He's trying to ask for some pet time. But again, I'm inviting everyone to make use of the chat box to network with each other. If you have questions, you may use the Q&A chat box, and you may raise your hand later. So we will take the questions after all the presentations are done. To kick off this exciting webinar, I'd like to call on the GNP Plus Co-Executive Director, Florence Riaco Anam, to set the scene. Florence, the mic is yours.
Good morning, good afternoon, good evening, good night. For the many people on this call, I can see joining us from different parts of the world. Happy 2026 from me and from the team in GNP Plus. I believe that this year is yet another year people living with HIV leadership resilience. We, people living with HIV, continue to demonstrate with our experiences, our lives, our passion, our ambition towards ensuring that there is a life for people living with HIV that is healthy and we have quality of life and is free from HIV stigma and discrimination and gives us dignity. We continue to power this movement just from our hearts. Sometimes we are paid, most times we are not. And we have worked resiliently, particularly through the shakes and the shifts last year. We made it to the end of the year. We start another year, hopefully, with the same level of enthusiasm and commitment to the work ahead. Today, we start our first virtual webinar in collaboration and with the leadership of Prevention Access Campaign to celebrate of U equal. I think that deserves a clap from wherever it is you are. For those of us who have run organizations or are running organizations, you know, to get to a 10-year milestone is a huge mountain climb. Seasons come, difficult ones, and people would rather walk away. But to get to a 10-year milestone or more, to get even a 1-year milestone is a big deal. 10 years is the biggest deal. So this is a big deal. In 2023, I said in a conversation with Bruce, those who have talked to me know how I get passionate about things. It wasn't planned, but I said something that I'm beginning to see play out, and I believe now more than ever is the truth. That U equals U is the message of HIV response sustainability. I'll take just 2 minutes to explain why I think that. One, my little understanding of epidemiology of disease responses is that for that to be successful, we must achieve epidemic control. How do we do that for HIV? We must reduce AIDS deaths, and we must cut the new infections, the numbers of new infections. U equals U gives us that opportunity, not only to ensure that when a person living with HIV is virally suppressed, we have length, quality, healthy lives, but that we are helping to drive down HIV incidence. So there it is. But this message, as you will hear many of the partners today, has helped to give evidence on the impact of treatment as prevention, has been useful to advance interventions like PrEP, but also motivate testing, access to treatment, prevention, appearance, among others. It is also community-driven, and that's why it will be sustainable, because it will outlive institutions, it stays with us in our community organizations and in our actions. I'm excited that we are doing Prevention Access Campaign. I'm excited for this collaboration to hear and to learn from everyone today, and I hope to keep this message at the center of our people living with HIV leadership this year. Thank you, and back to you, Inan.
Thank you so much, Florence. And thank you for reminding us of how important the messaging of U equals U is. And for reminding us that 10 years is not a joke. It's a milestone that deserves its celebration. Now to have that, for us to have that celebration and to review what the 10 has been, I'd like to call the new Executive Director of Prevention Access Campaign, Monique Carey. Monique, hi.
Thank you so much, Anand. And thank you, Florence. And thank you to GNP Plus for your leadership and your partnership. Hi, everyone. As I've been mentioned here, my name is Monique Carey, and I'm the new Acting Executive Director at Prevention Access Campaign. And it is an honor, truly, to be here celebrating 10 years of U equals U. It is deeply intentional that this first moment of the 10-year U equals U milestone is grounded in people living with HIV across regions and across lived realities. 10 years ago, PAC did not gather around U equals U thinking they had created a slogan. They knew that they were holding evidence, and they knew that if communities carried that evidence forward, it could truly transform lives. Anniversaries in public health are not just celebrations. They are checkpoints for us. They force us to slow down and take stock, not of what we hoped would happen, but what actually did. And they ask us to look honestly at what has been proven by science, at what has truly changed in people's lives in our health systems, and at who made possible when evidence alone was not enough. Because the progress in public health does not move forward on just data alone. It moves forward when people trust that data and it carries into their communities, and they insist that it be taken seriously. So U equals U at 10 gives us the answer to all three of those questions. We have evidence that has held firm over time. We have impact that reaches far beyond individual outcomes into health. And we have a movement led by people living with HIV who have transformed science into something that the world could act on. Everything that follows rests on that science. U equals U is not an opinion, and it is not a matter of personal interpretation. U equals U is one of the most rigorously established findings in HIV science. Across large studies, across different populations, and across diverse settings, the evidence has shown us the same result again and again. People living with HIV who reach and maintain an undetectable viral load do not sexually transmit HIV. And that finding did not emerge from a single study or moment in time. It was built through years of careful research, confirmation, and follow-up. And 10 years later, that evidence has not weakened. It has only been reinforced. But as we know, science alone does not change the world. Evidence can exist on paper and still fail to reach people's lives. The real question is not if U equals U is true. The real question is what happens when people trust it, believe it, and are supported to act on it. When U equals U is communicated clearly, confidently, and consistently with compassion, the data shows us something really powerful. U equals U changes behavior across the entire HIV response. U equals U does not just operate at just one point in the care continuum. It works across it. It shapes our decisions long before someone enters the clinic, and it continues to matter long after treatment has begun. Let's start with testing. When people understand that HIV is treatable and that treatment prevents transmission, something important shifts. Fear begins to lose its grip. HIV testing becomes less about anticipated loss and more about access to care and support. That makes testing more acceptable and over time more likely. Then comes linkage to care. U equals U pulls people into care by offering something many messages never did: hope that's grounded in evidence. Not false reassurance, not promises, but a clear understanding that treatment can protect health, relationships, and futures. That clarity helps people take the next step and reduces avoidance, and it opens the door to sustained engagement and care. The data also shows us what happens after diagnosis. When people understand U equals U, the pathway forward looks different. People are more likely to start treatment early, not because they feel pressure, because they can see what treatment makes possible. They are more likely to stay engaged in care over time, more likely to take treatment consistently, and more likely to view care as something that supports their lives. This understanding matters because lives are not linear. People move, systems change, care can be interrupted. And U equals U is especially powerful for re-engagement. It gives people a reason to return to care without shame or fear. It reminds them that treatment is not about treatment or compliance. It's about protection. It's about agency, and it's about treatment as empowerment. All of this leads to viral suppression. And viral suppression matters because it protects health and prevents new transmissions. But the impact of U equals U does not stop there. U equals U changes how people live. It improves quality of life in ways that are often invisible in clinical charts, but are deeply felt in everyday experience. It supports mental health by reducing fear, anxiety, and isolation. It restores intimacy by allowing people to form and maintain relationships without fear of harm. It makes family formation possible on people's own terms, with confidence and clarity. Also strengthens social connection by replacing silence and secrecy with openness and trust. These outcomes are not secondary or optional. They are central to sustained health because people stay engaged in care when they feel that their lives feel whole and dignified and worth protecting. When evidence drives health outcomes, it also becomes a tool for advocacy. U equals U fundamentally changes how we argue for treatment access. Treatment is not only life-saving at an individual level, it is prevention at the population level. And it is protection for partners, families, and communities. And it is a public good that benefits everyone, not just people receiving care. This matters because many laws, policies, and practices were built on outdated assumptions about HIV. They treat people living with HIV as risks to be managed rather than as partners in public health. U equals U challenges that framing with evidence. It shows that supporting access to treatment strengthens public health, while punishment and exclusion undermine that public health. And it gives communities and advocates a powerful, evidence-based foundation to push for policies that reflect science, dignity, and justice. U equals U has provided one of the strongest evidence-based challenges to HIV criminalization laws and discriminatory practices anywhere in the world. These laws were often written in a different era, based on fear rather than science, and on assumptions that HIV that no longer holds. Laws that punish people for their HIV status ignore what the evidence clearly shows us today. They assume risk where the science shows us there is none. And in doing so, they unhelp. They discourage people from testing because knowledge of one's status can carry legal risk rather than protection. They push people away from care instead of drawing them into treatment that protects both health, individual, and public health. And they reinforce stigma and discrimination in ways that make sustained engagement in care more difficult, not less. Community-led U equals U advocacy has been essential in exposing this contradiction. People living with HIV have used the evidence not only to defend themselves, but to advance a more effective and a more just public health response. That leadership has helped shift the conversations, influence policy reform, and make clear that laws and practices must align with the science if we are serious about ending the HIV epidemic. None of this progress has happened automatically. The evidence does not defend itself. People living with HIV have done that work. They carried U equals U into the exam rooms and training spaces and in courtrooms and policy debates. into families, relationships, and everyday conversations. They translated complex science into truth people could live with, trust, and act on. They insisted that the evidence be taken seriously when it was uncomfortable and defended when it was dismissed or misunderstood. That leadership is why U equals U became more than just a finding in journals. It became a community-led movement. And that leadership is why we are here 10 years later, not just marking time, but preparing to carry this work forward into the next decade. So one lesson from the past decade is clear. Evidence does not scale itself. Even the strongest science can stall if people are not supported to use it with confidence and care. That confidence has to be built. Skills have to be practiced and not just learned, and implementation has to be supported over time, especially across diverse cultural, legal, and health system contexts. And that's why we are proud to have U equals U University, to support the people who are already carrying that work forward, to provide the tools, shared language, practical guidance to help ensure that U equals U is communicated accurately and confidently, and to make sure that the science can be adapted in ways that fit local realities while still protecting its integrity. So as we celebrate 10 years of evidence and impact, the question before us is not whether U equals U still works. The science is clear and it remains strong. But the real question is how we protect this evidence. How do we adapt it into changing realities? And how do we pass it forward in ways that continue serving people living with HIV? So our next decade of U equals U will not be defined only by these new tools or new technologies. It will be defined by how well we support people to use what we already know. And it will require the same thing the first decade did: community leadership. Leadership that insists on accuracy when misinformation spreads, leadership that demands access when systems fall short, leadership that centers dignity, equity, and lived experience at every level of response. So this webinar series is not just a celebration of what has been achieved, but it's a recommitment to equity, a recommitment to access, and a recommitment to ensuring that every person living with HIV everywhere can benefit from the full power of U equals U. Thank you for the leadership you have shown over the past decade and for the leadership you will continue to show in the years ahead. With that, I will turn it back over to our host. Thank you.
Thank you so much, Monique. The next decade will be 2036. Gosh. How old are we going to be in 2036? And we're hoping that there will be new PLHIV leaders who will bring the U equals U movement forward. And I believe there will be, so that there will be new turnover of new leadership. Thank you, Monique, for highlighting that the U equals U is a movement led by people living with HIV. That U equals U is not an opinion, but a result of a rigorous scientific research. And the evidence is strong. After the science, now we are going to highlight the very important part of this webinar, the PLHIV power, the PLHIV leadership. We're going first to Brazil. Enrique Avila of Brazil is going to share the work in his country on U equals U. Please share with us how the power of people living with HIV has led to the success of the U equals U movement in your country. Enrique, over to you.
Hello, good afternoon, good night, good evening, and good morning for everyone. I would like to thank you for the invitation. It's very important for us here in Brazil to participate in initiatives like this. Many times we end disconnected from the rest of the world because the language barrier. Portuguese is not a widely spoken language in the world. Well, I'm a little nervous because I'm not used to present in English, so please bear with me. My name is Enrique Avila, and I've been living with HIV. I was a child. I'm served at the global coordination from the, from the Luso Plus network, the network of people live with HIV in Portuguese-speaking countries. I speak slowly. Uh, to start our presentation, let's go back in the time a bit, back to 2016. Is I started in Durban in 2016 during the AIDS International Conference. At the time in Brazil, was a talk of the long transmission risk, and we're still living under the condom dictatorships. Campaigns against stigma were being developed. We are still suggestive and susceptible people of transmission HIV. Participating in the AIDS conference was a youth network as a young leader, along the use clarity and the objective. Understand the undetectable equals untransmittable meant. Sorry, I'm nervous. Uh, After returning from the conference in 2017, we launched during Brazilian AIDS Congress the term indetectável equals intransmissível, the Brazilian term from tropicalized term, U equals U. And all mark, this is mark, green and the yellow colors of Brazilian flag. We took the lead movement to make this happen and quickly, and the less bureaucracy became. If we waited the healthcare on the government to bring it, it would take a long time to reach this you needed know. Right? To reduce the stigma for people living HIV/AIDS in Brazil. In the same year, the media also worked hard in partnerships to UNAIDS and the social movements in Brazil. TV Globo, the largest channel in Brazil, launched the web novel This called Malhação with a serodiscordant couple. This novel is very important for young people in Brazil because it's a high audience and talking in Brazil about serodifference and HIV and the non-transmissible HIV for the young people in Brazil. Everything started changing when the government launched the Combined Prevention Mandala. This combination prevention mandala brings together various options of prevention and strategy also under treatment from of prevention of the years. The mandala, I show for you, this mandala combined about the treatment, PrEP, PEP, and another mix for prevention to the HIV/AIDS in Brazil. Over the years, being undetectable became more well known in the country. And this became public policy both and the national states in Brazil. The government began implement communications campaign. So this campaign is from the Brazilian government, indetectável equals intransmissível, the same indetectable transmittable from the government Brazil, and another inside is from community council in Salvador, Bahia, a city we live here. And another is one creator, content creator, have a channel in YouTube, Positividades. He talk about undetectable equals untransmittable in Brazil for the young people, for gay people, for all people. Share your audience on Instagram. Content creators all start to talk about this undetectable, about serological status, opening the goal of promoting the end of the stigma. This way was a fundamental for us to get to where we are today. We still have a long road here. We have a fight hard against the stigma and the discrimination. Host the International AIDS Conference in this year is the guarantee that we will guarantee with activists, lay leaders, and the decisions making in HIV field from around the world to the build a new beginning together. The global political situation demands attention. The geopolitical reconfiguration requires care and the fight to maintain what we have and the care and more rights. Adult lands have been created in Brazil to protect people living with HIV. The stigma is very present now. People suffer psychological violence at work, at home, and in relationships. The stigma and the discrimination index conducing in partnership with organizations such as UNAIDS, Justice, and the Food, with 1,784 respondents, reveals an alarming scenarios in the majority of people living with HIV/AIDS. 6.1% have suffered some from the off dies. The research details that of this violence occurs both in the private sphere, with 41% report discrimination from their own family and the public and the professional life. In nearly 20% lost their source of income, and the 6% suffer physical assaults due to their HIV status. Yeah, we have been working tirelessly to reduce the stigmas and the prejudice being victim people to join us in the seminar activists and share this message. Undetectable equals untransmitted. It's a fight began 10 years ago. We continue for many more to ensure less stigma, less discrimination, and full quality of life for people live with HIV. Thank you very much. Obrigado. I'm nervous.
Obrigado, Enrique. Thank you so much for preparing your presentation in English and for being courageous to speak in English. Thank you so much for the interest and enthusiasm and dedication. And Enrique, thank you so much. So just to kind of like recap of what you've mentioned, the turning point came when the government launched the Combined Prevention Mandala, the one that you showed earlier, which brings together powerful various options and prevention strategies, and also addressing treatment as a form of prevention over the years. And it also became the U equals U also became well known in your country, and it became both public and became public policy both at the national and state levels in Brazil. And you've also mentioned about the Stigma Discrimination Index conducted in partnership with UNAIDS, where 64.1% of people living with HIV reported that they have suffered some form of prejudice, and 41% reporting discrimination from their own family and in public and professional life, and nearly 20% lost their sources of income, and 6% suffered physical assaults due to their HIV status. These are very, very important information that you have shared with us, and thank you so much. Thank you so much for highlighting the Brazilian PLHIV power. We might have met 10 years ago, 2016, while going to the past, and we're also projecting the future. Okay, let's fly from Brazil. How many hours? 17 hours to Doha, Qatar, and then 15 hours to Ghana. We're going to Accra, Ghana. We're going to have Abdul Fatah Salifu, who will share the experience work of NAPLAS, of U equals U at the country level in Ghana. Over to you, Abdul.
Thank you, Enid. Good evening, good afternoon, everyone. My name is Abdul Fattah Salifu, and please confirm if you can hear me very well. The internet here is very sketchy.
Very, we
Okay,
can hear you well.
wonderful. Yes, just wanted to also express gratitude for everyone sparing the time to join us today. I know the year is just starting, and it's not very easy for some of us, especially going back to work and starting your office. And in fact, we couldn't do better than actually sparing time for this wonderful webinar. And as a young person living with HIV, this is a very passionate topic for me. And knowing that I've also done a lot of community work, working with young people, and of course, marginalized population, that of those belonging to our minority groups, this message is very important. And it has carried us from the past and to the present, and we are looking forward to what the future will bring to us. Yeah. So I started working with NAPLAS Ghana not long ago as the executive secretary for our national secretariat, and that means that I also head our programs. And over the past few months that I've been with NAPLAS Ghana, our key message has always been very clear. Once you start treatment, the ultimate goal is to get to undetectable status. That is when you can no longer transmit the virus, but of course, be able to live your life normal as any other person. But more importantly, you already know your viral, your HIV status that most people don't know. So I'm just going to be giving a perspective of someone living with the virus from the West African region, who has also been on treatment for so many years, and some of the community work we do here in Ghana. Oh, what's happening to my cursor? This thing doesn't seem to be moving. Oh, okay. Sorry about the technical issue there. I was trying to find the right buttons. Yeah, so the previous speakers have already given us the understanding of U equals to U, but someone who is also taking the treatment and someone who is also very young and growing up, U equals to U actually represents a big breakthrough that most of us don't usually communicate when we are doing our community advocacy, because apart from just the clinical aspects of the HIV response, there are also the advocacy parts and the clear messages that our community members should be able to understand. And sometimes also translating the message down to community level knowledge, ensuring that people actually understand it and are able to utilize that information is also very important. And we have heard previously that it proves that the treatment can also be used as prevention. I think currently in Ghana, we are doing our review of our national strategic plans, and the message has always been clear. Let's not try to separate treatments and prevention, because treatment is also very important for prevention. When you have a lot of people reaching undetectable status, you are also ensuring that you are not spending a lot to keep those who are not yet infected having equitable access to prevention commodities. And of course, it also brings about the foundation for dignity, ensuring that the rights of people living with HIV are also protected, but more importantly, ensuring that we are having meaningful inclusion. Because over the past years, a lot of people have been afraid due to stigma and discrimination, not trying to actually bring themselves forward to be engaged, especially in the HIV response at national level. So how did U equals to U transform our? You are no longer in a position to transmit the virus. You actually gain this restored hope that you never thought you would have. It gives you the soft, and I can assure everyone on this webinar today, I have worked with a lot of young people, especially in the northern parts of Ghana, who are always concerned about how they approach people, whether they have to go to social gatherings, afraid of always transmitting the virus. But once we started the U equals to U campus through UNFPA supported programs, and more recently with our Wagakusha program advocacy campaign that just ended with UNAs, that communication was very clear, and it also helped to build the confidence level of our community members.
Abdul.
It was, yep.
Sorry to interrupt. May I ask you to speak slowly for our translators to catch up?
Oh, sorry.
Thank you. Thank you.
Sorry,
Thank
I
you.
got carried away. These topics
No,
are very passionate.
your
Okay, I'll try
presentation
to.
is very well.
Yeah, thanks. Yes. So as I was speaking, U equals to U also ensures that the fear of transmission is also reduced. Um, when we were doing our campaigns, especially with young people who are actually belonging to the LGBTQ plus communities, sometimes it's very hard for a community person to go to the health center asking for example, condom or lubricant. So the fear is always there. So once people know that they can no longer transmit the virus if they stay religiously well, adhering to their treatment, then the fear of transmission disappears. Then it will enable health relationships, and this was explained by the previous speakers, but also importantly, our adolescent girls and young women are very passionate about starting families on their own. When we get a new person testing positive, the first question we are usually asked is, can I get married? Can I give birth to a child without infecting the child? So U equals to U has actually helped us to get over that fear of self-stigmatization so that you look beyond just having HIV to the positive aspect after becoming undetectable. Of course, you have to stay adherent to your medication very religiously. And of course, I've already explained adherence and treatment uptake. We are now seeing reduced dropouts from treatment over the years because of side effects of the ARVs, which have now become better with a single pill combination. We used to have a lot of young people dropping out of treatment because initially people didn't actually understand what the treatment. But over the years, we have actually completed a lot of treatment literacy campaigns, ensuring that our community members really understand what the medications are, what they do in the body, but more importantly, what they do socially for our community members. Yes, and of course, we can't talk about U equals to U without mentioning relationships. That is very important for our social lives. And in fact, my presentation, I believe a lot of people would have seen my presentation spiritually because everybody was talking to my presentation. So I won't try to spend so much time here. We have seen a lot of people having a renewed intimacy relationship with their partners, and this comes as a result of the trust that your partner has, knowing that you can no longer transmit the virus. So you can have your relationship, your intimacy, knowing that you are well protected. And we have seen that a lot of families are now welcoming community members, accepting them for who they are, and not because they think they could contract the virus, but also protecting and ensuring that they also adhere to their medication. Once they understand that when you get to undetectable status, you can no longer also transmit the virus. And we have seen a lot of community members within our support systems also increasingly disclosing their HIV status. So for example, if you are going into a new relationship with someone, we have seen a lot of people trying their best to actually make it clear that he or she is actually positive and go beyond that to educate their partners that they are undetectable and they can't transmit the virus. We've also seen that a lot of people do no longer stress about living with HIV because you can now live well and more normal than even somebody who doesn't know their HIV status. And we've seen the resilience that have built up over the years when have actually stayed adherent to their treatment. And of course, we can't talk about the community side impact without talking about the public health impact as well. And for our community members, especially right here in Ghana, with the support of the self-testing kits, we have seen a lot of increased testing, and we have seen a lot of increased treatment uptake. Usually when somebody is tested and the person is diagnosed, we have seen that a lot of people will run away, want to take treatment. So from now, we have actually liaised with the health centers so that once somebody gets tested and the person can be referred to our community support systems where the person can actually get the education, the empowerment to ensure that the person understands the treatment and ultimately reach undetectable status. Of course, we have seen also new infections also reducing, especially among young people and young key populations. Over the years, we have seen that a lot of people are now becoming aware of HIV prevention commodities, such as the PrEP and then the vaginal rings that we now have everywhere. But more importantly, a lot of people now understand that when you get to undetectable status, you are no longer able to transmit the virus. So that message is always clear when we are meeting our community members. And the health systems, through our community-led monitoring initiatives, have also shown that we are seeing a lot of improvements in the retention of care. And I've mentioned in my previous submission that it also ensures that our prevention is also cost effective, because once you get a lot of people to undetectable status, nobody's able to transmit the virus anymore, and therefore you spend less money trying to get a lot of treatment prevention commodities to people. And of course, the success stories are a lot. I've already mentioned quite a few, but we've seen self-esteem, mental health, and confidence levels being boosted for our community members. We have seen adherence and retention in care. These are just repeated points from my previous submissions. But more importantly, we are seeing a lot of our community members using their lived experiences to tell their stories, to bring about reduction in stigma and discrimination, both at the community levels where our grassroots communities reside, to the national level where we dialogue with the government to cause a change, especially around communication in HIV prevention and treatment. Now, these are some of the campaign initiatives that we have done over the years to ensure that people are understanding the messages and are able to relate well and also use the message for the wider impact of our community members. But it also highlights what we can do moving forward. And the first one is the awareness campaigns that I've mentioned. We have seen a lot of development partners like UNFPA. We have seen the lots of government institutions like the Ghana AIDS Commission, who also support us in creating this awareness. And we have seen a lot of growth in the social media space. We have seen a lot of influencers telling their stories and bringing people together to ensure that we also understand the message around being undetectable. And of course, we have seen integration into our community health dialogues. Recently, during our end-term review of our national strategic plan, and we are just moving into the next global fund funding request proposal writing. We have pushed for some of these key messages to be well embedded in those. Because of the funding cuts, we are now pushing so that some of the community-led responses are also funded at the national level. So these are some of the success stories that I've just teased out. It highlights some of the adoptions that we have seen in the past. We have seen a lot of political push to ensure that U=U messaging is also very clear when prevention campaigns are also being run, not just by the health ministries and the health services in Ghana, but also civil society organizations working within the HIV response. We have seen it being integrated into the prevention strategy here in Ghana. We have seen national endorsement of U=U messaging. Right now, if you go to any health facility, especially those at the central level, you find a lot of U=U messaging posters, flyers pasted almost everywhere within the facility. So it is not also just empowering our community members, but also empowering the community health workers, those who also provide us the services, making sure they are also very well empowered and equipped to provide the right services without being stigmatizing or judgmental. And of course, this was already mentioned, we have seen a lot of community leadership as a driver of success. We can't achieve this if we don't have our community leaders or community members sharing their stories. The stories are very, very important. It's a different thing reading something on a text or reading it on a flyer than actually listening to somebody speaking about their life experiences. During our campaign, sometimes you go to tell your story and somebody looks at you and say, well, but you don't look like you are living with HIV. So the clear picture they have within their minds is somebody living with HIV is actually somebody who is very sick, looking sick, with bones showing everywhere. When you are healthy, people don't actually believe that. And that is the power of U=U. It is not just also preventing transmission, but also ensuring that people who are living with the virus are also living well and living the best of their lives. And of course, we can't talk about all this without talking about the key enablers that will ensure the success of U equals to U campaign. Within Ghana, we are having a lot of viral load issues and monitoring, and it's part of the integral indicators of the global HIV/AIDS targets. And this has to be ensured and provided more effectively and equitably so that our community members are having access to it. Without viral load access, nobody can actually do any viral load test to know that you are reaching undetectable status. We need a stigma-free healthcare environment. We don't want people to be stigmatizing, especially to our criminalized and marginalized population, and therefore ensuring that they also have access to the right services to get the right care that they need. And community education and peer support, that is something very integral that NAPLAS Ghana is doing. We need to ensure that we scale that up and scale it very well and support it with funding. It's high time we left external donors, the big donors, to internal domestic resources, mobilizing government support for this initiative. And of course, sustainable treatment supply chain is also very important. And of course, there are challenges. We can't talk about all the rules without talking about the bridges and the hurdles that we had to cross. And one of such I have mentioned is the viral load testing issues that we have here. We still have stigma and discrimination, but misinformation, misconception about HIV still persists, and also drawing back some of the progress that we are making. But the push on advocacy messaging, especially around U equals to U, has been so impactful and so progressive that we are also seeing reduction in stigma and discrimination. We also need to ensure that the legal and policy environments are also very conducive for our populations. Right now in Ghana, we are having a pending anti-LGBTQ+ bill. We don't know when Parliament will bring it up again, but ensuring that the legal space is also safe is very important, because once the legal space is not very safe, we can't have the right services and we can't have the right support that we need. And the inequitable access to treatment has to also be ensured. We have seen a lot of stock out of medications that have disrupted a lot of treatment access for a lot of people. And once you leave treatment, HIV rebounds very quickly and more aggressively than before. So we need to ensure that people are always on treatment, getting their pills and medications as and when they need it. And as a way of closing, we need to ensure that investment in equitable access for treatment is well ensured. I mentioned that we need to bring back our focus to our local domestic resources, ensuring that the political will that surrounds it also ensures that there's financial commitments to it, because you can't just say you support it, for example, at policy level without allocating resources to that. Strengthen partnership, government, very important. The funding cuts have highlighted the importance of this, and we cannot do without it. And of course, our community members as messengers, I've mentioned that sharing our stories is more powerful than somebody reading a text off of a flyer. So we need to empower our community members to also share more, use the social media space. There are a lot of ways that we can share our message, and that can also go a long way to reaching more people than traditional methods would. And normalizing U equals to U in every health conversation should also be something that we think about, because we only mention it when we are talking about treatment, the goal of treatment, but we need to make broadly to prevention, to resources, equitable access to medications, and ensure that the message is widely spread. So thank you very much, everyone, for giving me the listening ear. I know I was too fast. I tried to speak slowly, but I was mindful of the time. And over to you, Inage.
Thank you so much,
you.
Abdul. Thank you for waving the banner of the young people living with HIV. And for me, this kind of webinars are very empowering, because when people, before people present, they would introduce themselves as people living with HIV, and that's not really happening all the time. Like, I am Envy, I am Abdul, and we're people living with HIV, and that's really powerful, empowering. And thank you for highlighting the stories, because in this era where data is highly politicized and highly monetized, think it is high time for us, people living with HIV, to be proud of our personal lived experiences, because our stories are also data, but data with a soul. And we have to remember to humanize HIV advocacy. So thank you so much, Abdul Fattah, for sharing your work and for the power of young people in Ghana. You have mentioned in your slide several times about the integration of BCU in policies and the benefits of having recognized U equals U. So let's fly back to Canada. We have two speakers from Canada. We have James and we have Alex, and they're very happy to share with us their work in Canada and sharing some concepts or ideas on U equals U in the national HIV strategies in Canada. So Alex and James, over to you.
Thank you so much. Alex is going to share the slides for us. Thank you. It's really a thrill to be here. Thank you so much for inviting us. My name is James Watson, and I manage the Stigma and Peer Initiatives at Reach Nexus at St. Michael's Hospital in Toronto, Canada. If you're not familiar with Reach Nexus, we're a national group of researchers where we're seeking to root HIV and syphilis and other STBBIs in Canada through public health interventions and community-driven research. I'm also a person living with HIV and joining you from Chesley, Ontario, in the middle of a two-day blizzard on the traditional territory of the Saugeen Ojibwe Nation. So if we could just pop to the other slide, Alex. Oh, Alex, you should introduce yourself.
Oh, I was just so into it, James, that I forgot. Let me go back a slide. Or maybe not. I'll just start here. Hi, everyone. My name is Alex Strand. I'm a research coordinator at the team at Reach Nexus. I'm calling in today from Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, the Chippewa, and the Wendat peoples. Yeah, I'm just really glad to be here today with James, talking about the U equals work being done in Canada. I'm also a person living with HIV and sort of take that into my approach to this work. And with that, I'll pass it back off to you, James, to start us off.
So when we talk about how U equals U took shape in Canada, it really didn't start with policy. By the mid-2010s, the science was already landing here, and researchers and clinicians were following the international evidence very closely. And within HIV care and research settings, U equals U is already being treated as solid and reliable science, even before it showed up in federal policy language. But that didn't happen in isolation, of course. Community leadership played a huge role. Organizations like CATI, which is a national nonprofit here in Canada, which is a main source of information on HIV, they were already translating the science into plain language resources and provider education and practical tools for people to actually use. And that work helped normalize U equals U across the HIV sector long before there was formal federal regulation. And around the same time, legal advocacy groups, including the Canadian Coalition to Reform HIV Criminalization, they were actively referencing viral suppression and transmission science to push for more modern and evidence-based approaches to HIV non-disclosure law. So then in 2018, Canada reached a real turning point. The federal government formally acknowledged that people living with HIV who are undetectable do not transmit HIV sexually, and Canada became the first national government to officially endorse the global U equals U campaign. And that matters. You could see it show up in federal public health messaging and in the federal prosecutorial guidance on HIV non-disclosure. And it was a clear signal that U equals U had moved out of clinical conversations and into federal policy. And after that, U equals U started to be reflected across national strategies and frameworks, including the Pan-Canadian STBBI framework, the Federal Action Plan, prosecutorial guidance, and public health resources. And even when the term U equals U wasn't used explicitly, the science was clearly embedded in how Canada was thinking about prevention and care and risk. And the federal government also developed resources that people could actually point to. The Public Health Agency of Canada, with community input, of course, developed plain language materials for the public and clinical guidance for providers and reference documents used in policy and legal settings. And those resources really mattered because they gave clinicians and community organizations and people living with HIV something official to stand on. They reinforced that U=U wasn't just an opinion or advocacy. It's, evidence-based public health guidance. But, here's the reality. All of this created a really strong policy foundation, but endorsement doesn't equal implementation. Provider education is still uneven here. The knowledge and understanding of U=U in the general population remains limited, and stigma and criminalization continue to undermine the health and quality of life for people living with HIV. So the gap between policy and practice is our challenge in Canada. Next slide. So what's not federal? And I think that's one really important boundary to name here, especially for folks outside of Canada. So in Canada, healthcare delivery and professional regulation and most clinical practice decisions don't sit at the federal level. They sit with the provinces and the territories. And the same is true when it comes to criminalization. While the criminal code is federal, provinces are responsible for administering justice and prosecuting most criminal cases. And that means that provinces have discretion in how they apply the law. And as a result, the risk of criminalization will vary depending on where you live in Canada. So even though federal endorsement of U=U really mattered, and it was a major win, it doesn't automatically translate into consistent practice or protection across the country. What someone hears from a healthcare provider or how the law is applied still depends on geography and even who you are. And that variation is a big part of the Canadian story. U=U, as we all know, only works if people hear it and understand it and believe it. And right now, that experience isn't the same everywhere. So when we talk about success, we have to look beyond policy wins and ask what's actually really reaching people on the ground. And that gap between endorsement and everyday practice is where the real work continues. Next slide, please. So, this is where community and national organizations really come in. If U=U is going to reach the general public and really land with communities of people living with HIV, sustained community action is essential. So across Canada, organizations like the Canadian Society, the Canadian Positive People Network, CATI, as I mentioned before, Reach Nexus, the organization that Alex and I work for, the Canadian HIV/AIDS Legal Network, and many, many local organizations and some incredible activists are stepping in where systems are falling short. And you can see a few concrete examples on this slide. CATI's U=U guide for service providers is helping frontline staff have clearer, more confident conversations. The Canadian AIDS Society's community roadmap lays out what meaningful U=U implementation should actually look like at the community level. And there's a certified online training initiative that's been developed called Treatment as Empowerment. It's a course that's been developed for health providers to bring U=U into everyday clinical practice. So together, this work focuses on educating providers and supporting communities and identifying those gaps so we can build campaigns and interventions that actually work. And the urgency is real here. Without more standardized guidance in healthcare, people keep hearing different messages depending on where they live or who they are. And when that consistency is missing, stigma thrives, and the U=U public health message gets weakened. So at Reach Nexus, where we work, we focus that work. We gather evidence, we name the gaps, and work to turn that evidence into action across research and policy in community spaces. So with that, I'm going to hand it over to Alex to talk more about what that looks like.
Thanks, James. So like James said, a big part of what we do is research and science. And so we all know how important it is to equip people with U=U knowledge, and the data we've been collecting really helps us to identify where we can improve our activities. And so I want to start first with our stigma index data. And so I'm sure many of you are familiar with the People Living with HIV Stigma Index. It is an internationally recognized tool. Within Canada's nation, we included questions to assess for U equals U related outcomes, including U equals U awareness, acceptance of U equals U, and also the impact that U equals U has on people living with HIV. Some important data came out of that. We found that generally people living with HIV in Canada in our study were aware of U equals U, but among those aware, only 67% actually fully believed in the U equals U message. In particular, we found that there were gaps within different demographic populations. Specifically, we found that awareness were lower among heterosexual and bisexual participants compared to gay participants. We also found that cis women were less likely to report positive impacts from U equal compared to cis men. And also a very important finding was that only about 50% of participants reported ever having a U equals U discussion with their primary HIV care provider. So, all U equals U is very important. As we all know, there is obviously work that needs to be done, to sort of hone that messaging in on different subsections of our people living with HIV population. Moving into I'm Ready data. So for those who may be unaware here, I'm Ready is a program run out of ReachNexus. It provides free HIV self-testing kits to Canadians through its mobile app, I'm Ready Test. And when users sign up for the app, there is a pre-survey. And so earlier in, I actually think January 2025, so just a year from now, I think U equals U questions were added into this pre-survey. And that was a big decision for us because we recognized that we needed to sort of get data on U equals U outcomes from this different lens, and this lens being people with a negative or status unknown HIV status. And so through some preliminary analyses, with a sample about 3,000 participants, I believe, awareness of U equals U was lower compared to our stigma index data, which was kind of expected. But then similarly, we also found demographic differences as well. We again found that heterosexual participants were less likely to be aware of U equals U. When we found that people of color, Asian participants, Middle Eastern participants, Indigenous participants were also less likely to be aware. And so again, just honing in on the idea that dissemination of knowledge needs to be more tailored to these different populations. And then finally, I want to talk about our general population data from CPPN, the Canadian Positive Peoples Network. And so a survey was run last year, a general population survey commissioned by CPPN, and it was conducted by the polling company Ipsos, and it was funded by ReachNexus and also Gilead Sciences Canada. And so this was a truly general population study survey among about 2,000 participants. And we found that among the general population, only 20% were aware of U equals U. And so even less than sort of our I'm Ready data set. And you can sort of see how, the data differs as we get more general with our sample. But essentially, among those aware, majority of those participants were actually Gen Z or millennials. So that was a pretty interesting finding. However, one finding that really struck out to us was that 66% of participants in the study believed that increased U equals U awareness, HIV stigma in the general community, the general population to believe that, I think is a huge thing, and only sort of gives strength to the idea that we need to further promote this. And then lastly, another point I kind of wanted to touch on was that about 60% also said that it was very important to include the U equals U message within sexual education in secondary schools here in Canada. And so overall, we see that more work needs to be done to diversify sort of where U equals U is being promoted and amongst who. And sort of, I think that's where U equals U University comes in. And so last summer, ReachNexus was able to support some Canadian participants in piloting the U equals U University led by Prevention Access. And so those participants will no doubtly inform our development of our own Canadian U equals U University. and train the trainer strategy, which I'll touch on a bit in the next slide. Yes. And so these are our plans essentially at ReachNexus. We really want to, promote U equals universally nationally. It's such a great resource, but also adapt the train the trainer model so that we can build our own Canadian network of U equals U trainers. And we're hoping to do this in a way that's representative of the gaps that we just saw through the data, and so that we can ensure that we're able to establish this waterfall effect within communities across Canada. And the general population and people living with HIV, of course, are aware of U equals U. In terms of mobilizing knowledge through our own sort of ways, James here hosts an amazing podcast called The Pausecast, and we're actually ramping up to launch season 3 sometime soon. And so U equals U is actually a good chunk of the episodes that we're planning to develop, because we recognize how important it is to sort of push this information into people's brains, as I'm sure you're tired of me here saying. And then lastly, us being such a big research group, we really want to keep exploring our data sets, keep developing evidence on U equals U outcomes in Canadians. We all know how important it is for data to exist. Sometimes it feels like governments and policymakers think things don't exist because there's no data. And so we really want to be sure and establish that, so that we can use that data to apply for funding, to do future work related to U equals U, and just really to create action. And you'll see that sort of bar down there. The more we can spotlight U equals U, the stronger our chances of capturing and sustaining the attention of governments and policymakers are. And I really do believe that. And just some final thoughts. Like James said, governments have endorsed U equals U, but action is needed. But we live in a world, obviously, where funding is extremely important. So increased and sustained funding is really needed to sort of support U equals U related activities, of course. And this sort of gets to the whole disconnect between policy and real world outcomes. We need more action in order to sort of close that gap between those two things. We need more efforts to include U equals U across a diverse array of sectors, including healthcare, education, social services. And lastly, all of this cannot be done alone. We all need to work together, as I'm sure everyone here can agree on. Meaningful progress really requires collaboration among governments, policymakers, activists, community members, researchers. We all need to work together and solve the problem of the HIV epidemic and also stigma associated with it. And with that, I thank you everyone here for listening to us.
Thank you, James and Alex. So the app, is that downloadable or is it usable
Already
outside?
Only downloadable Canadians.
Okay.
Right now.
Thank you for sharing the points from ReachNexus. So we are now going to Q&A. We have 15 minutes. If none, I'll ask questions. I have questions to Monique and to James and Alex, actually. So to Monique, very much for the presentations. So there are a few points that I kind of like noticed that maybe we can also address. So there are still misconceptions of U equals U among health professionals, and I think that's the one sector that we should be working with. And then also the U equals U may be challenging. Or the tracking of U equals U may be challenged, especially in countries or settings where there is very limited viral load testing. So from the last 10 years, what points can you share about the misconceptions of the health professionals? How can we work with them effectively? And how do we make sure that we have the viral load testing available for countries who are countries where it's not available yet?
And I'll jump in, and if I forget parts of that question or not, I'll ask you to repeat them. But starting off in terms of the last years and really thinking about how do we get our clinicians and our providers on board, I think jumping about collecting the data, that has been essential. And what we've seen across diverse country contexts is that the number one place where people learn about U equals U is from their clinicians and providers. So that's essential, because even if governments support it, if the messaging is not making its way through that clear person, that's problematic. And that's the focus on the education and really getting this message for clinicians and providers. But in addition to that, some of the interest data that we have show is that even among persons who know about U equals U and believe in U equals U, only 1 in 3 of those share that information with their clients. And that's really, like, to me, very understanding. So once we get past just general awareness and knowledge, which first is the first step when working with our clinics, and we have to have those U equals U champions within clinics and providers to be able to make them understand and champion U equals U within. But I think that even with those who know and have the evidence and believe evidence, when we ask why, they're not sharing that information, it's a lot of them say they don't have the confidence or the ability, or they struggle with clear communication and being able to translate U equals U to their clients. And I think that is telling. That is a clear place and indication for intervention, is one, increasing that awareness and then building that confidence to be able to share that. So some of the interventions we look at thinking about how to just give them clear messaging scripts to be able to broach the conversations, and what are those key moments and interacting with clients that for them to be able to share U equals U messaging. Now, the second part, when you mentioned we're advocating and sharing U equals U in places where we have limited testing and monitoring, I think that that's where we use U equals U as an advocacy tool. And that's really important to do so, is to be able to champion the multi-width of U equals U, not only for persons living with AIDS, but in terms of public health, to advocate the systems to invest in more viral load testing and monitoring, and using them of the, not, like I said, individual health, but population health as a motivator. And it's one of our strongest advocacy tools for being able to do equity about treatment access, but also scale our load testing and monitoring and be able to champion for those. And I think there was a third part, I can't remember.
No, there are only 2 questions.
Okay.
Yeah, 2 questions. Thank you very much. No, because I think from my experience, the countries that I've worked with, the most difficult sector, or most challenging sector to work with in U equals U, is the kind of like changing how the health professionals think about undetectable equals untransmittable. And I think that's where the challenge is up until now, and going towards the other 10 years, we already have good strategies from other countries on how to deal with health professionals and U equals U. So thank you so much. And James and Alex, thank you for introducing yourselves as people living with HIV. It's really empowering, like researchers, academics, people living with HIV. It's amazing. So my question, like you have highlighted, and maybe I'm wrong, you have highlighted earlier that the endorsement does not equal implementation. The endorsement of U equals U of government or provincial at the provincial level may not equal implementation of U equals U. And people with HIV may hear inconsistent messages about U equals U. Is there any like specific approach or any lessons learned of the kind of approaches that could be effective in shifting that behavior? So that U equals U becomes a practice within clinical settings rather than.
Well, that's a good question. I mean, I think it takes the community organizations and the activists now, right, to really start pushing that, because each province is so unique that with different set of guidelines and rules. When we're talking about, healthcare professionals, there's a real issue about getting, to be consistent across the board about zero risk language. And because they're not used to working in that kind of language. So it's, I think that it's about having conversations, getting to the Canadian Medical Journal and writing papers and showing that, so that it's more widespread. So there's a feeling around patient-centered care, right, which is a good thing. But patient care can also mean the physician is making judgments about people, perhaps about what they can and can't handle, and what their behaviors will be and won't be after hearing this news. So I think it's about education and really approaching the medical associations to focus on the solution, coming from researchers and from community. Have anything to add to that?
I think really, I think what James said is the bulk of what I wanted to say. I also just want to recognize sort of the barriers because of sort of the differences between provinces and sort of whatever political party is in charge at the time. The receptiveness to changes sometimes can vary. So I do think that approaching professional organizations is a very smart move, right? Oversee sort of everyone under their profession. So yeah, I agree.
Thank you. Thank you so much. Randy has asked question in the Q&A chat, but I'm also not sure if the question I asked is similar. But Randy, would you like speak, or are you able to speak, or maybe I'll just say it. So Randy's asked, as we look toward the next decade of U equals U, how do you from proof to practice during U equals U is fully implemented, consistently integrated, and equitably applied across healthcare, public health, policy, and community settings? I think Randy's question is much broader. But I think Monique's response and James and Alex's response also kind of like response to Randy's question. So thank you so much. I'd like to ask Enrique and Abdul if any lessons learned that you can share with our participants. Maybe very quick lessons learned. What have you learned from your experience? How can we effectively implement U equals U through leadership of people living with HIV? Let's start with Abdul. Very quickly, lessons learned.
Thank you, Enid, and I'm happy to come back again to speak. And I'll just share a few, in fact, two lessons learned that we've experienced in the past, especially here in Ghana. So the first one is about differentiated service delivery. What we actually realized in the past is that somebody has challenges with adhering and reaching undetectable status, is usually the issue is not like one size fits all. So it doesn't really affect everybody at the same level. So you need to approach that person on an individualized level to really understand the person, especially what we do at NAPLAS Ghana, like understanding our community members, relating well with the issues surrounding treatment adherence, and also access to the complementary services like the viral load testing that I've mentioned. Sometimes if we don't have that critically, it is not usually seen because we don't have indicators that is measuring the amount of complementary services, for example, liver function tests and the rest that somebody receiving care is accessing. So those things are usually missed and not really considered, but all of those play their part to ensuring that U equals U is implemented and implemented very well. The other one is around integration of the services. We have talked about integration and integration and integration, and it has come very strongly, especially now that we are in a limited resource environment and with competing national priorities. Of course, we have to see how we bring the services together so that we are not spending and duplicating effort and making care very tedious. For example, you go to the health center and you are supposed to take your services, your ARVs here, you go to the lab on the different facility, you have to move to another facility for you to get the results. It's hectic. So we need to see that the services are more intertwined, where you can actually access them more easily and more effective wise. Yeah, so we need to see that happening. If not, we can't achieve U equals U. Like you've mentioned, endorsement doesn't really translate to implementation. And of course, until we provide all the underlying conditions, we can't really achieve our goal. So those are the things that we have gotten working with our community members and of course the government and other society organizations here in Ghana. Send over.
Thank you, Abdul. Enrique, would you like to share? We want to speak in Portuguese. We're good. We can do the translations.
Ok, thank you. Nosso maior aprendizado.
So you're speaking Portuguese, so we will switch into English. Okay.
Português ou em inglês? Ok. Nosso maior aprendizado aqui no Brasil foi relacionado ao combate, né, ao fim do estigma geral. A mensagem do I igual a I veio como força para as pessoas que vivem com o HIV, com serem vistas menos como vetores de doença, mas como seres humanos integrais. O I igual a I passou a ser difundido e compartilhado em todas as redes, ONGs e pelos governos estaduais e locais e o governo nacional. Isso que o estigma, apesar de grande, seja reduzido. E o papel da juventude, né, na ação foi completamente de sucesso. Estar presente, construir juntos essa mensagem é o que nos deixa forte. Thank you. Portuguese is more easy for me.
Thank you. Uh, Thank you, Enrique. Thank you so much for sharing the lessons learned. On the closing of our webinar, thank you so much for joining us. Thank you for sharing your time. The first month of 2026. This may be the first webinar that you have joined for joining and celebrate. Well, not really celebrate, but marking a milestone of the U equals U. This is the first of the two webinar series that we are organizing. We are organizing two webinars. The first one is for Latin America and the Caribbean, North America, Canada, and North and West Africa. On Thursday, we are organizing another set of webinar for East Africa, for Eastern Europe and Central Asia for Asia and the Pacific, yeah, the eastern part of the world. So if you're still able to join us on Thursday, that's 3 p.m. Bangkok. So thank you so much, everyone, for joining. But before I would like to call on again Florence to have some closing remarks, everyone.
Thank you so much, Inad. I don't know if there's people more excited than I am right now, because this is the first time we've decided to do webinars to capture the region in Latin America and the Caribbean. I think last year we did a lot of webinars and we weren't able to split them. We tried a little to capture the community from Asia, and it resulted in a lot of things and us connecting a bit more stronger. I hope that this is also going to some way of also connecting. I think a lot of that today that I want, I just want to highlight that it is now more than ever that we must come together as people living with HIV. And I think just one message as we close, I was reflecting here, listening to everyone speaking and looking at the diverse things happening in different countries and what everyone do, and even if it's at federal government level, Wakakosha and doing the work for self-stigma and putting in the aspect of relationships and young people into agency we all get. I'm just reflecting that us in this call right now have been movement, but found here who defied the narrative of HIV or AIDS, depending on when they were in the movement. There was the AIDS kills messages and all horrific messages. And there've been people that ahead of us that stood up very strongly, and we joined them, and it continues. We come here boldly with our stories of deep stories of pain, of shame, of resilience, to keep the narrative of HIV very central to what our realities are and what we live in. So we don't backing it up with science, which U equals U has done, gives us even more power to continue to do that. I feel like it is a moment for which The HIV story needs a little bit of a turn and a shape, and U equals U gives us the science, the opportunity, and the confidence to be able to say a different yet more very empowering story about HIV. And we are the people who must do that, sitting different places where we are. So thank you again for being here. I hope you can join second. Please stay tuned. There's a lot of vision between us at GNP Plus and colleagues at Prevention Access Campaign to make sure that we are all about U equals U. Thank you very, very much. And congratulations to U equal 10 years anniversary. Thanks.
Thank you, Florence. Feedback at the chat from Matthias. He was asking, how can initiatives like this connect more with global processes, and how can we create stronger spaces for collective learning? As Florence has mentioned, please stay tuned with our next announcements. I think GNP Plus and PAC will have a extended partnership for U equals U University. What that entails, we will be sharing that information. And GNP Plus is planning to convene a regional PLHIV meeting among PLHIV networks across Latin America. That might happen in the last week, in the weeks of February. We are still trying to fix and to kind of sure that the details are correct. And we'll be reaching out to you in Latin America and the Caribbean to make sure that we're able to connect the PLHIV networks and leaders within Latin America and the Caribbean in the next month. So please stay tuned. Thank you so much, everyone, for joining us. Thank you so much, Monique. Thank you, Enrique. Thank you, Apatao. Thank you, James. And thank you, Alex. Of course, thank you, Florence. And Helena. Helena, hi. If you can on camera, thank you so much for the support. And we will see you again. Oh, if you're going to join us, we'll see on Thursday. But if not, then please stay tuned for other engagements on U equals U. Thank you so much, everyone. Good day. Have a nice night. Good night from me. But good day to you, everyone. Bye-bye.